Hi, Professor. This is Margarita Brichak, and I will be doing a presentation on a patient that I had in the family practice clinic that I'm at currently. This is going to be an adult HEENT presentation. The patient ID is 2222434. Patient initials is SP. She's 60 years old, Caucasian female. The chief complaint was a follow-up for hypertension and a sore throat. HPI. So SP is a pleasant and non-toxic appearing 60-year-old white female who presented to the clinic to follow up on hypertension and a recent sore throat. The patient reports 8 days of sore throat, dry cough, and nasal congestion. Her symptoms have all improved in the last day or two. She states that her aggravating symptoms included talking, which triggered the cough, and gardening outside. Alleviating factors included consuming cough drops and a medication called Zylol, which did cause severe drowsiness. And she rated her overall symptoms today as very mild and mostly improved. Follow up on her blood pressure, she reports she's tolerating all her medications well, currently on hydrochlorothiazide 12.5 and losartan 50 milligrams. She continues to limit her salt intake and has been participating in water aerobics during the weekdays. She denies any cardiovascular symptoms like chest pain, shortness of breath, swelling in her legs, headache, dizziness, visual disturbances, feeling weak or lightheaded. Her past medical history includes anxiety and depression, hypertension, vertigo, high cholesterol, GERD, eczema, chickenpox as a child, arthritis, and surgical history of a tonsillectomy. She is up to date with all her preventative cares. Her allergies include codeine and erythromycin base. There is no family history available on her. And regarding the review of systems today, she did report feeling very fatigued, which she is attributing it to the medication called Zylol. She also reported nasal congestion, a sore throat, and a dry cough, as well as a runny nose and frequent sneezing when outdoors. Her vital signs in clinic was a heart rate of 77, a blood pressure of 139/80, a temperature of 97.3, respirations 18, SpO2 of 99%, pain 0 out of 10, and she is 5'2", 130 pounds with a BMI of 23.8. There's no radiology or pertinent studies available on her. Regarding her physical exam, she did appear healthy weight, neat appearance, and non-toxic appearing. Her head, there was no obvious signs of injuries or trauma, and it was normal in appearance. Her eyes had no obvious signs of trauma or injury. Her lids and conjunctiva were free of discharge or pallor. Her eyes were non-injected and non-icteric, and pupils were 3 millimeters. Perla, her corneas appear grossly intact. Eyes, nose, mouth, throats. Her hearing is intact. She did have some opacity to her tympanic membranes bilaterally. Her nose was normal in appearance with no signs of trauma or injury. Her nares were patent and clear nasal discharge was noted. There was no pain to sinuses on palpations, and her oropharynx did appear normal. Her tonsils were absent, and there's no exudates or erythema in her throat. She did have moist mucous membranes and normal dentition. The patient's trachea is midline. The thyroid is normal in size with no nodules or tenderness. Her neck is supple and she has full range of motion. Lungs were clear to auscultation, anterior posterior. No adventitious lung sounds were noted. Normal work of breathing with no accessory muscle use. Cardiovascular exam, S1, S2 noted. No murmur, click, gallops, auscultated. No swelling in her extremities, and no JVD. Her abdominal exam was reassuring. She declined the genital breast exam. Musculoskeletal exam was, again, reassuring, as well as the neurological, psychiatric, skin, lymph node exam. The differential diagnoses I have for this patient is seasonal allergies, upper respiratory infection, strep throat, and sinusitis. The assessment and plan for this patient was based on my research that I did on stat pearls and current evidence-based practice articles. I did diagnose her with seasonal allergy. That's based on increase in nasal congestion and throat irritation for several weeks now. She reports her symptoms are worse when she's outside or gardening, which would make sense due to the high pollen counts we have. She has tried the over-the-counter Zydol with improvement, but it made her extremely drowsy. So I decided to order her Flonase and Zyrtec, and that's based on current guidelines of how to treat seasonal allergic rhinitis. Regarding the pain in her throat, her symptoms have improved, and her vital signs and physical exam was reassuring. The patient did decline a rapid strep test, which was one of the diagnostics that I wanted to order. So I educated the patient on honey therapy, which is current evidence-based practice for sore throat. It has proven to soothe the throat. It also has antiviral properties, and it's great for antibiotic stewardship. As far as patient's blood pressure, again, we diagnosed her with essential hypertension. She was within JNC8 blood pressure goal of 140, less than 140/90, with her pressure today being 139/80. She'll continue her current medication regimen of losartan and hydrochlorothiazide. She should continue daily exercise, healthy diet, and stress reduction. The reason that this case was meaningful for me is I live in a part of Oregon that they like to call the Death Valley, which is notorious for extremely high pollen counts. I have a lot of patients that suffer from seasonal allergies. This seems to be a very common complaint right now, so I did want to become more familiar with current guidelines and treatment options, since this is something I'll be dealing with very frequently. An example of how it collaborated was with the patient preferences. This particular patient does like to have more of a holistic approach with complementary medical practices. That is why I initiated the honey therapy. The patient was very appreciative that this was a non-pharmacological treatment option for her symptoms. As far as the Gene Watson carrier theory, I did use the 7th curative factor of promoting teaching and learning regarding the honey therapy and the use of the seasonal allergy medications, and continuing her antihypertensive medications and lifestyle modifications. Thank you.